Hello everyone, good morning everybody. I am Sania from Prostate Wellbeing. I am sure all of you must be keeping good health. Today we are going to discuss a very important topic, that is benign prostatic hyperplasia BPH. Benign prostatic hyperplasia BPH is the non-cancerous enlargement of the prostate, usually benign in the begin in the 50s in men, and which in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and it is the most troublesome aspect of this condition, as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theatre or cinema rather difficult. A doctor such as urologist can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Mayank Rastogi, MS MCH from Mumbai Urology. He has a rich experience of 12 plus years and hands-on expertise in enterology. He had worked at some elite hospitals and currently working at Apex Hospital, Bareilly. Dr. Mayank Rastogi has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. Welcome, Doctor.
Thank you. Thank you for your nice introduction.
Thank you so much, Doctor. Doctor, moving on to that topic, to the questions, what is basically BPH?
BPH is a condition which is usually found in old age, so mostly more than 50 years of age, but sometimes it can start from 40 years of age also. Some patients I have seen who started problems of BPH in 40 years also. It is a gland of reproductive system. Its main function is in young age for production of sperms. But in old age, it has no use. But because of many unknown reasons, it usually gradually increase in size in old age and start obstructing bladder outlet. After obstruction of this bladder outlet, patient gets troubled of poor steam, frequency, urgency, so many symptoms because of this prostate happens in old age.
Okay, doctor. And what causes BPH? What are the main causes of BPH?
There is no proved causes of BPH. It is related with age. There is nothing very solidarity usually associated with BPH. It is age-related disorder. Just as we grow old, so few percentages of persons get enlarged prostate in old age and gets all the problems of BPH.
Okay, so as doctor said, it is due to old age or the age thing BPH occurs.
Yeah.
Doctor, what
but
are
not all patients? Not all patients. Few percentage of, but prevalence of BPH increases with the age. Like when you are in 50s, only 1 or 2% patient of the total population will have symptoms of BPH. But as it age increases, you will see that in age of 70s, 80s, 90s, as much as 30 or 40% patient may get problems of BPH.
Right, rightly said, doctor. Doctor, what are some of the symptoms associated with BPH? If we talk about the symptoms, so what are the symptoms which are associated with BPH?
Symptoms, because of BPH, there are two types of symptoms. One is storage symptoms and one is voiding symptoms. Patient's main problem is usually with BPH is voiding symptoms. Like patient will complain of poor steam. He has to strain a lot during urination. He will have hesitancy. Like when patient go for urination, it takes time to start urination. Apart from that, steam will be intermittent, like stops and start, like urinary steams. Apart from that, there are storage symptoms which are because of secondarily when bladder got disturbed due to obstruction. It will patient develops voiding symptoms like frequency of urination, urge or very sudden desire to pass urine, and the patient is not able to hold urine, and by on the way to the toilet, some drops of urine comes out in underwear. They are the main symptoms of BPH. Sometimes patient may develop retention also, like sometimes patient comes in emergency that his urine is totally stops, and he comes into the emergency in very painful condition. That is also because of BPH. And I have also seen patients because of BPH, patient may develop renal failure also sometimes. Chronic retention like picture, like gradually धीरे 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 करके यूरिन वहां पे रुकने लगता है और अंदर धीरे धीरे करके भरने लगता है ब्लैडर में और किडनी में, और किडनी स्टार्ट्स फेलिंग. So these are the very large spectrum of BPH, starting from small symptoms to the dreaded complications of BPH like renal failure.
Yes, doctor. And जब हम symptoms की बात कर रहे हैं, when we are talking about symptoms, what are the most troublesome symptoms of BPH?
Troublesome symptoms depends on the patients. Patient के लिए क्या important है? जैसे for a working person, frequency also is a major problem. Like you are busy in your work, and you have to go urination lots of times. It's a troublesome symptom for that patient. And for old age patient who's sitting at home, frequency may not be the major problem for patient. So patient to patient symptoms, patient को किस तरीके से affect करना है उसकी quality of life पे वो depend करता है. But serious complications of BPH are repeatedly infections, bleeding in urine, and this renal failure I told you just now. These are the major dreaded complications of BPH.
Okay, doctor. And doctor, what are some of the treatments which are available for BPH?
Treatment of BPH depends on some investigation, in which spectrum of investigation patient is lying. Depending on that, we advise treatment. Sometimes we advise. There are two main types of symptoms, like medical treatment and surgical treatment. Medical treatment includes this tamsulosin, silodosin. These are some medicines, and finasteride, dutasteride. These are the medicines which we give for medical treatment of prostate. But there are certain indications in which we decide patient to go for surgery, apart rather than to give medical treatment. There are two types of in short, there are two types of treatment: the medical treatment and surgical treatment.
Okay, so there are two types of treatment, as the doctor said. Doctor, now we have a live viewers question who are watching this live. Aman is there asking, Doctor, what are the potential complications of BPH?
Potential complication is first is retention. Sometimes in BPH, some infection occurs, then sudden increase in size of the prostate happens, and patient lands up in acute retention of urine. Acute retention of urine means suddenly urine stops, and patient is painful agony. Patient comes, rushes to the emergency that I am not able to void urine, and he is in tremendous pain in his lower abdomen. And in emergency, we catheterize this patient, and patient got relieved of acute retention of urine. This is the one of the most common complication of BPH. Apart from that, repeated infections, repeated urinary infections. Symptoms of infections are like patient will complain of burning micturition, blood, painful micturition, and frequency, urgency, incontinence. The urine comes out in the clothes. And third is the bleeding complications. Sometimes prostate bleeds, and bleeds like hell. It bleeds like tremendous bleeding. And fourth is stone formation. Secondary to bladder outlet obstruction due to BPH, patient may develop stones in urinary bladder. And fifth is I told you, when the case is neglected, then patient will end up in renal failure also. These are the few complications of BPH.
Okay, so these are the complications of BPH, as the doctor said. Doctor, another viewer, Akshay Jain, asking, Doctor, is BPH a precursor to prostate cancer?
No, BPH is not a precursor to prostate cancer. Prostate cancer is a separate entity. BPH is a benign problem. It will never turn up into cancer. प्रोस्टेट का एक हिस्सा ऐसा होता है जिसमें कैंसर के होने की संभावना होती है. बीपीएच का कैंसर से कोई लेना देना नहीं. Patient may comes with the ultrasound report that prostate is enlarged. That is usually BPH. But prostate cancer is different problem. But when we treat patients of prostate, we definitely investigate patient in the form of serum PSA, prostate specific antigen. By testing PSA, we identify those patients who are suffering with prostate cancer. If PSA is in normal range, that means we are dealing with benign problem like BPH. But when prostate PSA is raised, then we should go into the direction of cancer of prostate. Treatment of BPH and prostate cancer is entirely different.
Okay, so the treatment is different, and as doctor said, it is totally different, BPH and prostate cancer. Doctor, there's another question from Harshit asking, Doctor, are there any lifestyle changes or home remedies that can help manage BPH symptoms?
Home remedy depends on what patient is suffering with. Patient major, what are the major symptoms of patient? Like if patient is suffering with storage symptoms, like patient is complaining that, sir, my main problem is the frequency of urination, then you should avoid more liquids, tea, coffee, cold drinks, like these things we can avoid so that our symptom will reduce a bit. But I always advise that if after age of 50 or 60 patient is developing symptoms I have mentioned, he should consult his urologist so that he can see that whether the patient is developing some complication or not. If patient is in a safe spectrum of BPH, he can be treated by medical treatment. There is no need of anything else. But only after some investigation, small investigations like ultrasound or uroflow, we can see patient in which spectrum of BPH patient is lying.
Rightly said, doctor. So you have to consult your urologist, as doctor said. It is very important. Doctor, next question is from Navneet asking, are there any minimal invasive procedures or surgeries that can effectively treat BPH?
Now, if we come to surgical treatment, open surgical treatment are obsolete, almost obsolete. There are rarely some indications for which we do open surgery. I think in last my 12 years of practice, I have never done prostate by open surgery. Why we do surgery of prostate by minimal invasive technique, which is called in terms of our department TURP, transurethral resection of prostate, in which in this procedure we go by urethra and transect all the resect all the prostatic tissue by endoscopic method. There is no cut, no कोई भी छेद या टाका चीरा कुछ नहीं होता. Patient usually discharged on after day or a day after tomorrow. Patient usually discharged by this after this surgery.
Okay, doctor. And there's another question: are surgeries safe for the person if somebody have BPH?
Surgery is usually safe. Now, in the by which technique we are doing TURP is bipolar energy we are using. In bipolar energy, there is very less chance of TUR syndrome. So, after taking fitness from anesthesia point of view, surgery is very safe.
Okay, so surgery is safe, as doctor said. Sir, there is another live viewer question, Rahul Vishwakarma asking, Doctor, is BPH a precursor to prostate cancer?
No, as I have already mentioned that BPH is not precursor of cancer prostate. It is an entirely different thing, and it starts in its own. It is not related like if you see in your reports that prostate is enlarged and it is BPH. After a few years, it will convert. It will convert to CA prostate. It's not like that.
As doctor said, it's not like that. Doctor, what are the earlier symptoms of BPH, and how can somebody knows and control the symptoms early? Is it possible to treat the BPH as early as possible?
Early symptoms are like patient usually complains of poor esteem. One of the most earliest symptom is poor esteem. Patients sees that his urinary stream is becoming thin and thin. It's not going far. It is going. It's going very near to his foot, and stream flow is not continuous. It is intermittent. Like sometimes it starts, sometimes it stops. It's like that. If patients looks his stream, it is going down, then he should consult his urologist.
Okay, so consulting the urologist is the most important, as doctor said. Doctor, there is another viewer, Divi, asking, hello doctor, does BPH affects the erection?
BPH as such does not affect erection, but it has been seen that we are giving some this tadalafil type drugs which gives benefit in erection also and BPH also, but not directly related with the BPH. But it's true that when you are disturbed with because of your symptoms, your erections goes down. Like if you are feeling problem of frequency of urine or poor steam, sometimes patient feels that the erection has also gone down. So treatment of BPH and poor erection can be treated simultaneously.
Okay, doctor. Ankit is here asking, are there any support groups or resources available for individuals with BPH?
Pardon?
He's asking, are there any support groups or resources which are available for individuals with BPH?
I am not knowing about this support groups, and I think if you are having some problem of your related with urinary problem, you should consult first your urologist. What he is saying that you should follow that thing.
Yes, so consulting the urologist is the most important and integral part. If you
otherwise,
are
patient lands up in complications of BPH. If it late diagnosed, then he will develop late complications. Like हमेशा मैं अपने पेशेंट को एक बात समझाता हूँ कि जैसे अगर बीमारी के लास्ट में आप हमें दिखाने आते हैं, तब तक यूरिनरी ब्लैडर की जो पावर है वो खत्म हो जाती है. उस समय सर्जिकल ट्रीटमेंट भी करेंगे तो you will not get that much of benefit from surgery. So if power of urinary bladder is preserved at the time of surgery, the results are very good. But sometimes patient comes to us when his bladder function has permanently gone. In that situation, if we go for surgical treatment, then the results are not as good. So I always advise to my patients anywhere that first consult your urologist There are small investigations by which we can put our patient in which spectrum of prostate he is lying. If he is lying in initial spectrum of disease, then we can treat patient simply by medical treatment.
Yes, very, very rightly said, sir. Very good advice. Don't get more complicated. If you are having any symptoms, go consult your urologist so that problem itni badi na ho. There is another viewer, Bhavesh Mittal. He's asking, are there any alternative or complementary treatments that can help with BPH symptoms?
Apart from this allopathic medicine, he's asking?
I think yes, he's asking alternative or complementary treatments. I think yes, that can help with BPH.
Some Ayurvedic doctor claims that few Ayurvedic medicines are available in the market which positively affect prostate. Again, मैं एक चीज पे जोर देता हूँ, आप modality of treatment पे कुछ भी जो आपका मर्जी आए वो आप कीजिए. But पहली चीज है कि आप अपने यूरोलॉजिस्ट से कंसल्ट करके कोई कॉम्प्लिकेशन तो नहीं है, अंदर कोई परमानेंट डैमेज तो नहीं हो रहा है, उसको इंश्योर करें. हमें दुख तब ज्यादा होता है जब पेशेंट हमारे पास लेट आता है, तो ट्रीटमेंट डिफरेंट थिंग है. पहली चीज ये है कि आप सेफ हैं कि नहीं, अंदर कोई परमानेंट डैमेज तो नहीं हो रहा है, क्योंकि प्रोस्टेट में सम टाइम पेशेंट्स डेवलप फ्यू सिम्टम्स बट अंदर सब कुछ खराब हो चुका होता है. पेशेंट का जो सिम्टम्स है वो बहुत कम होते हैं, लेकिन अंदर आप देखेंगे तो वो क्रॉनिक रिटेंशन में पड़ा हुआ है, किडनी भी खराब हो रही है और वो मेडिसिन पे मेडिसिन लिए जा रहा है. तो पहली चीज है कि आप अपने यूरोलॉजिस्ट को कंसल्ट करें, देखें कि अंदर कोई खराब तो कुछ नहीं है. उसके बाद there are few Ayurvedic medicines also. You can consult your Ayurveda doctor. I am not denying for that, but I again request कि पहले आप ये देखें कि अंदर कोई भी ऐसी चीज तो नहीं हो रही है जो बाद में परमानेंटली डैमेज होने की वजह से रिकवर नहीं हो पाएगी. ये मेरा रिक्वेस्ट हमेशा अपने पेशेंट से और व्यूअर से रहता है.
राइट डॉक्टर, एज यू सेड कि आप कंसल्ट करें यूरोलॉजिस्ट से बिकॉज इट इज वेरी इंपॉर्टेंट एंड आई होप भावेश गॉट योर आंसर कि देयर आर अल्टरनेटिव ट्रीटमेंट्स बट यू हैव टू फर्स्ट कंसल्ट योर यूरोलॉजिस्ट दैट एवरीथिंग इज फाइन, देन मूव ऑन टू सम procedures. Doctor, as you know, the lifestyle, some people drink alcohol. Are there any side effect or containing or some lifestyle changes is required in the treatment of BPH, or somebody should not do do's and don'ts of BPH, if I can say?
BPH has no relation with your food or whatever your lifestyle. It does not affect your lifestyle से BPH का कोई लेना देना नहीं है, लेकिन बीपीएच के सिम्टम्स की वजह से कई बार आपको अपना लाइफस्टाइल चेंज करना पड़ता है. लाइफस्टाइल की वजह से बीपीएच का कोई लेना देना नहीं है.
ओके, सो लाइफस्टाइल से बीपीएच का कोई लेना देना नहीं है सर ने कहा, बट BPH होने के बाद you have to take care of your lifestyle and be more precautionary. Sir, there is another question from our viewer asking, how does BPH affect urination patterns during the day and night?
BPH has usually some patient develops a median lobe enlarged. When the median lobe is enlarged, then symptoms may exaggerate during night time. Some patients may complain of nocturia, like उनका sleep disturb होने लगता है और उनको रात में भी कई बार जगना पड़ता है और कई बार उठते उठते यूरिन बेड में भी निकल जाता है. तो डे और नाइट इक्वली अफेक्ट करता है BPH, particularly when median lobe is enlarged in prostate. Night symptoms get worsened.
Okay, doctor. There is another question from Jay Mitra asking, can BPH affect my ability to participate in sports or physical activities?
BPH does not affect in that manner. As I told you that BPH is the age-related problem. Yeah.
Doctor, can you please repeat the answer of Jay Mitra? And can BPH affect my ability to participate in sports or physical activities, please?
As I told you that BPH is a old age problem. BPH does not come in young age. So BPH is a old age problem. The other age related issue can affect, but prostate directly does not affect your sports ability, your walking, your day-to-day activity. If you want to go for tracking, it does not affect in that way, not at all.
Okay, so it does not affect your physical activities, and as doctor said, it is an age-related issue. Doctor, there is another question asking, doctor, what are the potential symptoms of BPH, and how can I identify the earlier symptoms of BPH?
I have already told you the early symptoms are poor esteem, straining, hesitancy, frequency, urgency, urge incontinence, like बार बार यूरिन जाना, अचानक ही आप बैठे हैं और अचानक ही सडन डिजायर आपको होती है कि यूरिन के लिए जाना पड़ेगा और जाते जाते कपड़ों में निकल जाना, रात में बार बार उठना, रात में कपड़ों में निकल जाना, यूरिन का फ्लो पुअर होना, जो फ्लो है वो कंटिन्यूअस नहीं है, रुक रुक के फ्लो आता है, यूरिन करने में जोर लगाना पड़ता है, पेट में जोर लगा के आप यूरिन कर रहे हैं. These are the symptoms, main symptoms of BPH.
Okay, doctor. Main symptoms of BPH, as told by doctors, are these. And doctor, there's another viewer, Biplab Krishna, asking what treatments options are available for BPH.
Again, I am repeating itself. Medical treatment and surgical treatment. Medical treatment includes tamsulosin, silodosin, finasteride, dutasteride, and surgical treatment. They are minimal invasive technique, TURP. Decision of medical or surgical treatment is taken on patient symptoms as well as few investigations in the form of ultrasound and mainly uroflowmetry investigation, in which we see what is your flow. Flow is identified by Qmax. Qmax is maximum flow rate, max flow rate. If your max flow rate is more than 15 ml per second, then we can continue on medical treatment. If your flow is less than 10 ml per second in uroflowmetry, then you are probably a candidate of surgery. There are few absolute indications of surgery in which we always advise for surgical treatment to the patient rather than medical treatment.
Okay, doctor. And doctor, as age-related, which is the best option for treatment, surgical or medical? Which is safe and which is the best treatment if somebody is, old age and having BPH?
As I told you that if patient is in safe, like in ultrasonography, there is no hydroureteral nephrosis, post-void residue is less than 30% of his bladder pre-void volume, and uroflowmetry is showing Qmax is more than 10 ml per second, we can continue with the medical treatment. But if Qmax is less than 10 ml per second, and PVA post-void residue is very high, and patient has IPSS score is more than 20 is coming, then we advise for surgical treatment. Or the main important thing is when patient is failing for the medical treatment, patient is not satisfied with medical treatment, then we go for surgical treatment.
Okay, doctor. Our viewers are asking questions. There's another question from a viewer. Doctor, is BPH is dangerous for someone? It is like harmful?
Yeah, if any disease is neglected, it can be dangerous. Definitely, it can be dangerous. If you neglect the case, that patient is neglecting his poor esteem, patient is neglecting his incontinence. Sometimes patient may land up in complications of BPH. I have already told about complications. Patient will end up in complications of BPH.
Yes, so it is, as doctor said, dangerous, and you have to consult and do not neglect the symptoms of BPH and consult the urologist as soon as possible. Doctor, there is another live viewer question. Ravi asking, what is the role of prostate-specific antigen (PSA) testing in diagnosing and monitoring BPH?
The main importance of doing PSA is to identify cancer of prostate. So there are few indications in which we do PSA. If patient's age is more than 50 years of age and patient is coming with any urinary symptoms, and patient is not having urinary tract infection, is in his urine routine microscopic examination, we routinely do PSA to identify, to diagnose early stage of prostate cancer. So PSA is mainly to detect prostate cancer, not BPH.
Okay, so it is used for measuring prostate cancer, not BPH, as said. So PSA is used for detecting prostate cancer, not BPH, as doctor said. Doctor, there's Swapnil Singh asked Chandel, asking, how does BPH impact urinary function, and what can I do to improve urinary flow and reduce frequency?
First and foremost is you can reduce your fluid intake to the optimum. एक भ्रांति होती है कि यूरिन में कोई भी प्रॉब्लम होती है तो आसपास के सब लोग आपको एडवाइस करते हैं कि ज्यादा पानी पियो, ज्यादा पानी पियो, तो ज्यादा पानी आपका यूरिनरी प्रॉब्लम को सेटल कर देगा। ऐसा नहीं है। अगर patient is developing frequency of urine, he should see whether he is taking too much amount of liquid. So first is reduce your fluid intake to so that your urinary output in 24 hours should be around 1500 to 2000 ml per day. First is. Second thing is you should avoid tea, coffee, cold drinks, like things to reduce frequency or urgency. Third thing is some exercises are there, Kegels exercises, to reduce your frequency of urination. And after this home remedies, if you are not improving, then you should consult your urologist, because I will not advise without doing few investigations. I don't advise any anticholinergic drug just to reduce frequency of urination. There are few investigations your urologist will do, and after that he will advise you medical treatment for that.
Right, rightly said, doctor. And doctor, another question is, caffeine affect BPH? Should we contain caffeine if somebody have BPH?
Pardon?
Asking caffeine drinks can affect BPH?
Caffeine itself does not cause anything with BPH, but caffeine definitely increase your frequency of urine. So you should avoid caffeine.
Okay, so avoiding caffeine, as doctor said, is important for BPH, and we are talking about BPH symptoms, the treatment, and we are also taking the live viewer questions. Doctor, there is another question that what is the role of prostate-specific antigen (PSA) testing in diagnosing and monitoring BPH?
I have already given answer to this question. Again, I am telling you, PSA is not for BPH. It is to detect early prostate cancers. So, if you have family history that your parents, parents in the sense your father, your uncle has any prostate cancer history, then you should start doing your PSA after age of 50 years of age. And we take the opportunity to do PSA when patient comes to our clinic with any symptoms of urinary problem, and we see that patient is not having urinary tract infection, because a common problem मैंने देखी है लोगों को पता नहीं होता है कि पीएसए कब करना चाहिए। पेशेंट इन्फेक्शन में अगर डॉक्टर के पास चले जाते हैं और उस समय अगर पीएसए करा जाए तो पीएसए बढ़ा हुआ आ जाएगा और वो एक फॉल्स अलार्म आपके फैमिली में एक पैनिक क्रिएट कर देगा कि भाई पीएसए बढ़ा हुआ है और इनको तो कैंसर हो गया। पीएसए अगर बढ़ा हुआ है तो इट इज नॉट मैंडेटरी दैट पेशेंट विल हैव प्रोस्टेट कैंसर। उसके बाद के कुछ इन्वेस्टिगेशंस हैं जिनके बाद हम कंफर्म करते हैं कि ये बढ़ा हुआ पीएसए प्रोस्टेट कैंसर की वजह से है कि नहीं है। मैं हमेशा एक रिक्वेस्ट करता हूं कि पीएसए का सैंपल देने के टाइम पे पेशेंट को यूरिन में इंफेक्शन नहीं होना चाहिए, अदरवाइज एक फॉल्स पॉजिटिव रिपोर्ट आएगी और पूरी फैमिली पैनिक और कंफ्यूज हो जाएगी।
Right, rightly said, doctor. And as you said, PSA is not for BPH. So, doctor, you have answered all the questions of our viewers. Any takeaway message for all our viewers watching this live session?
My message to my patient is to always, मैं हमेशा खुश तब होता हूँ जब पेशेंट मेरा सही टाइम पे मेरे पास आए। मेरे पास करने के लिए अगर पेशेंट के अच्छे के लिए बहुत है तो मुझे बहुत अच्छा लगता है। पेशेंट जब लेट आते हैं तो हमें बहुत दुख होता है। मैं हमेशा एक ही रिक्वेस्ट करता हूँ कि एक बार कंसल्ट कर लीजिए। योर यूरोलॉजिस्ट विल डिसाइड दैट आपको मेडिकल ट्रीटमेंट की भी जरूरत है कि नहीं। Many of the patient comes to me after investigation. I just assures them that you have nothing. Sometimes patient come with anxiety. I have done ultrasound for another reason, and in ultrasound is showing enlarged prostate, and patient comes to me. So in ultrasound, if prostate is enlarged, that does not mean that you need treatment for that. Prostate is enlarged, but you have no urinary problems. You don't need any treatment, and you just follow up after 6 months or a year.
Very, very nice takeaway message for the viewers that go to the urologist, take precautions because precaution is always better than the cure. Thank you so much, Dr. Mayank. Thank you so much, Dr. Mayank Rastogi, for your valuable time, and it has been quite an informative session for our viewers. We really look forward for many such sessions in coming time. Thank you so much for your valuable time, sir. And thank you so much, all the viewers, for an excellent participation. For more information and updates, stay connected on our page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to all.
Thank you, Sonia. Thank you.